Welcome to the SpineLine podcast. My name is Dr. Vivek Babaria, and I'm a member of the Public Outreach Committee of the North American Spine Society and an interventional physiatrist here in Newport Beach, California. I'd like to welcome everyone to this next installment of our podcast series, showcasing an interesting article from SpineLine, NASA's membership magazine. Today, we will be discussing the article by Dr. Philip Louis and his team entitled The Professional Use of Social Media in Spine Surgery. This article was published in the November-December 2024 issue of the magazine. We will have the pleasure of hearing from Dr. Louis directly along with his team. We hope that we can engage you in an exciting conversation and learn where the space is growing. Just a quick reminder that SpineLine is now digitally formatted in a new and exciting look. To read this article and any future issues, please go to spinelinemag.spine.org. Without further ado, please welcome Dr. Philip Louis, MD, or spine surgeon up in Washington.
Hi, great.
Before
Thanks
we
for
begin,
having me
sir,
on today.
please give us a nice introduction of who you are and how you got started with this.
Sure. My name is Phil Louis. I'm an orthopedic spine surgeon out of Virginia Mason Franciscan Health in Seattle, Washington. Sort of raised in that area and love that region. So, I am a huge advocate of, health literacy and patient education in that crazy world today. And I think that's what sort of brought me over to the topic of sort of social media, which we have seen boom all over medicine and especially in spine care. So thanks for having me on today.
Well, a lot of people are entering that space of social media and their presence. But your article is very interesting and dives into many important topics, which we're excited to highlight today. One of the first questions I have for you is that obviously the role and the growing role of social media, especially in spine surgery. So what initially motivated you to explore this topic, and how has your perspective evolved through your research?
Yeah, no, that's a great question. And I think, we have patients that come in all the time and, they've gone to Dr. Google for a lot of the sort of knowledge that they sort of try to bring in. And I think what we have found that spine care to a certain extent is still a little bit of a black box. And there is a lot of negative connotation with, back pain, neck pain, nerve issues. Yeah, people see injuries, on TV from various accidents or sporting events. But there just isn't a lot of like easy access to information that is been sort of well sniffed out. And I think where this all started was we started asking our patients, okay, so you found out you had this problem. How did you try to learn about it? Right. And, it started with, well, I Googled this and I Googled that. And then all of a sudden, like we see the transition going to, we started seeing these Facebook groups about this, or we saw a TikTok video about this, or these Instagram posts about this. And like from a professional setting, like a lot of people will hop onto LinkedIn and just look at similar cases and learnings. And so we started realizing, okay, so now we are entering, or at least healthcare is entering this different phase of information sort of dissemination, right? Social media is already huge in other areas, and healthcare has always sort of lagged behind in that extent. But I think recently we've seen that pick up from both a patient perspective and even a professional and colleague perspective.
Very fair points, and it brings up some exciting questions. Number one, how do we control the validity or accuracy of the information that's on social media?
Yeah, I think that's the biggest issue we face today, right? If we set healthcare aside and certainly spine care aside right now, I mean, all the news and the concerns of social media is, how do you actually, separate the real news from the fake news, right? And I don't know if we actually have a great answer right now from a sort of healthcare perspective. And what I will encourage people to do is, learn more about social media and become active in it, because ultimately it's self-policing early on, right? It's going to be, hey, we are presenting this information, and then the more people we have that are utilizing these platforms are able to provide, their opinions, and provide their experience. But we hope that if there is a lot of misinformation that is being spread, that we as a professional community are willing to, raise our voices on these social media platforms and say, hey, look, I disagree with this, respectfully. But I think it's going to start with a lot of self-policing early on, and especially with, spine diagnoses and treatments, and a lot of the symptoms that come into play in recoveries. There's not like a black and white, right and wrong to start with.
Who do you think is responsible for the information? Do you feel like our societies need to take a step foot? Is it going to be the private practice doctors, academic doctors? Who should be the ones steering where the information comes from? Do you feel like there's a societies need to do more?
I feel like societies need to do more, and I will congratulate a lot of them because I think they're trying to. But I think if we're to be honest with ourselves, I think it honestly starts with us, right? Because we are the bearers of that, information, and we, take this oath at some point that we want to do no harm, and people think that's just about treating patients, but that's also about, providing information in this day and age, especially in this digital world. So ultimately, I think it starts with the provider or whoever is actually providing that information, that there needs to be some ownership, right? There needs to be some moral code, some ethical standard that we keep and sort of maintain as we provide this information. The problem with social media sometimes is it's easy to just back away, right? You see something, you disagree, and you sort of poo-poo it and move on. But I do think that at some point, as we become more comfortable with engaging with each other on these platforms, we need to be able to speak up, and we need to be able to sort of create this community of, okay, we want to provide this information. I think where the societies become really important is that it provides sort of like a stamp to this type of information, right? So, hey, we have these NAS clinical practice guidelines, right? Yeah, they change from time to time to time, but so much work gets put into those collections of evidence that, in essence, say, you know what, here is this opinion, but here is what years of research and collaboration has also sort of presented from an information standpoint. But we should be working hand in hand together as individuals and with the societies, both academics, private practice, hospital employed. We should all own that information.
That's fantastic. It almost seems kind of like when we write our notes. One purpose is to serve the community, someone Googling. And the other purpose, it almost seems, is like as colleagues being able to deliberate on cases together. So I feel like there's multiple platforms or multiple uh, formats that could be utilized. Do you feel that you cater your social media content to an audience, or do you do like a specific format and just hope that the right person gets the right information?
Yeah, that's a great analogy, right? Um, we write notes for multiple reasons, and that's why we're so careful about what we're writing sometimes, because it's part of public record, and then everyone sort of has access to it. So social media is a little bit different from that regard, right? And I think that, and Kendra's hopped on, so I would love to hear her opinion on that too, is that each platform is a little bit different, right? And I think that where people have to be careful is you share a type of information and you just sort of throw it out there as a shotgun approach. I think we have to be thoughtful as to where we're actually providing that information, right? What you um, put out in like an Instagram or a TikTok or even a YouTube is often a very different audience than the information you're putting out on a LinkedIn or some type of sort of workplace professional community. And so I think that it's really important to sort of target your message to the, largest demographic of audience that you think is going to be reached by that platform.
Fair. Uh, And yes, that is a challenge. Have you found one platform that you just end up posting on more than another?
For me personally, I as I get a little bit older, I sort of fall away from the reels, the ability to creatively, you know, create content
Create
from a stories standpoint, from a real perspective, like a TikTok or an Instagram. And yeah, I still will post information there, but that's purely patient facing, is what I have found. And then YouTube for me has sort of served as a hybrid between that, right? Because now you're capturing a different audience. And then there's LinkedIn, which is clearly professional. There are some patients who use it, and that is very much a colleague to colleague discussion, and a much more of a technical or a workplace type of message that is being sent versus a more public facing platform.
Sure. Someone like myself, I'm in private practice. And when you think about growth of a practice in your brand and marketing, obviously it's hard to neglect the social media space. What advice would you give to someone like me trying to build their brand and utilizing social media? Do you feel it is a tool to help grow who I am and help my patients get to know me?
Yeah. Well, I think we'll take two approaches. Actually, Kendra, why don't you share your opinion first? Because you are, you can sort of think of this question from a patient perspective, right? Still in medical school and making their transition soon. When someone like Dr. Barbara, who is creating a social media presence, what do you want to see? Or what is the most meaningful content that's being posted? And then I'll piggyback off of that from the other side.
Absolutely. I think it can be a very useful tool in order to like engage with patients in a level that makes a physician more approachable. I think the type of content, as you guys were discussing, created, it really matters. And in a lot of ways, the verbiage used in that content can either make a physician seem really approachable by a patient or not. Um, from a marketing perspective, somebody who speaks to patients in like a way they understand, and they might be scrolling through whatever they might be on Instagram, X, Facebook, they come across a video that's intriguing to them in a about a subject like their back health that they want to know about. I think that's definitely a way to grab their attention. Um, I think the double-edged sword of that at the same time is it also means like more attention from a patient and from the like populace in general, um, to what you're saying and how you're saying it, and more, I guess, scrutiny, if you will, over what you're sharing on those platforms. Um, so I think, I think it can be very beneficial. I think there's also potentially some downsides there. From a physician perspective on very much needing to be careful with diction in what's being posted.
Yeah, and those are great points. And I would say, for people who are starting out with any sort of social media content, it's very awkward feeling, right? You feel like you work so hard in life to separate your like personal and private life with your professional life, and then all of a sudden you feel like you're blending those together, and there's this sort of awkward sensation of like, how do I actually present myself? Right? Because we all know we may act a little bit differently in different situations in life. And so I think one of my biggest pieces of advice is, right, like, what is the goal of the content you're creating, right? If it is a marketing and building a practice, then, I actually don't think it like the actual education should be the first step. That's important. You want to be honest, but, you know, patients are looking for providers and surgeons and doctors that they can relate to, right? They want to see people who genuinely care about their problems, who look happy, who are able to actually like clearly discuss something. And I think that's the first step of social media is, okay, who are you and why should people see you if you're thinking from a marketing perspective? And I think once you are able to establish that, then I think the information becomes really important because people will start seeking you for that information.
Consequences of what we post. Obviously, student Dr. Kendra Cooper mentioned that there could be some downside or harm in what we do. Doc and Mrs. Kendra Cooper, can you guys comment on potential harm of the material that we create and post?
Yeah, I can kind of, I guess, share my perspective as a student first. Going through rotations in medical school, we've all had the patients that um, print out articles that they've read online or print out sometimes even like literature to bring in with them. I think the same can apply to social media posts that they've seen. Um,
Um,
I think the consequences from that can be like I was kind of talking about earlier, if word choice isn't careful or if message isn't being conveyed in a very clear fashion through social media, it potentially can be something that is brought back with the patient kind of to the visit and in some way or another has shaped and formed their opinion about whatever you as a provider are going to share with them well before maybe you even ever meet them. And so I think when providers are interacting with social media, um, just kind of being aware of that is something that's greatly important.
Yeah, I mean, I think the consequences we face on social media, you sort of think through as the same consequences in which we practice medicine, right? Like everything we do is discoverable to a certain extent. And, no one's ever going to feel sorry for us, right? And that just means that we just need to be really careful with how we're presenting that information and the information that we're presenting. Because, if you look outside of healthcare, people take snippets all the time and they get misrepresented, across different platforms. And so I think the biggest consequence that we face isn't necessarily that it damages our practice, but it sort of damages the field in general, right? We think about the spine world, like I mentioned earlier, right? It's already like this black box and not a great connotation with everything. And people know the horror stories really well. And what we don't want is, we spent so much time in these last few years and trying to open up the field a bit more to get people to understand how we think and why we think and how people do well when they're well indicated for whatever technical treatment is or intervention is needed, is that we've set our field back. And so the consequences are very different than the specific consequences we face in practice, but I do think that we should think about them similarly because the impact is so much greater than that single incident.
And obviously, in your article, you've used many scores and discern as one of the scales that you use to evaluate some of the articles and things like that. Specifically for some of the things that you found, um, there was a part of your article that talked about readership and um, citations that authors can increase because of their social media presence and just their presence online, and that leading to more opportunities for them. So not only from a brand perspective, but it seems like physicians can grow professionally by having this platform.
Yeah, that has been well established now. And it's actually very cool to think about how social media can actually impact us professionally now, outside of patient care. It is clearly evident that if you promote your work on social media, and let's talk about peer-reviewed manuscripts, it is directly correlated with the number of citations and the number of hits on that research. And it's just because of the reach, right? Like we spend so much of our lives trying to garner attention for the work that we do. Um, and social media just happens to be a collection of platforms in which, even in the most academic sort of corner of what we do, there's a direct impact from engaging social media. So, you know, people get concerned of saying something wrong or doing something they'll regret. One of the easiest, lowest barrier entry steps to take in social media is to simply like open up your academic work to the public and show them, hey, here's a paper that we published, right? It's already peer reviewed. It's evidence that's searchable in general. And it ultimately kind of helps nurture the real information, or at least the, you know, peer reviewed information that's being disseminated out there.
How do we make that fun? Obviously, discussing an article and going into p-values is not clickbait like a picture with screws and rods. So how could we improve our content so people are actually going to good articles online, especially through our through our media posts.
Yeah, I mean, something that like Kendra and I have talked a lot about in the past, and she can share one of her research experiences too, is that like the outcomes of our research are not meaningful unless we know how to discuss that result or the findings with all sorts of people. And so, we're not trying to make it clickbaity, but like people have to understand what we're doing, and I think that we have to find ways to make our work interesting, right? Because clearly there's something about the work that we find interesting. And it's like you have a good story, you having something you want to tell someone, right? You have to find a way to make it interesting and to pair it to whatever type of population you're trying to reach.
You've been very humble about how successful you are on social media, and if people Google you, like amount of following and hits that you've gotten on your content. Obviously, you've been very successful. Uh, as we wrap up, what are some keys to posting that doctors should learn about and just be mindful of when some takeaways to make good content?
Yeah. I'll give you the doctor's perspective, and then I think Kendra should give the student perspective, because I think what we're seeing now are students seeing their first clinical experiences and wanting to like show the world that they're like a real doctor now, and that's where a lot of people are getting in trouble. But I think from a physician standpoint, social media is still sort of scary to think through. Um, I think it's actually worth talking to someone who knows what they're doing, right? Because I think that they can instill confidence in what your goals are, and they can sort of help direct you to do things like safely and effectively, right? It's like if you're learning a new surgical technique, right, or you have a new intervention that you're getting ready to perform, we don't just sort of hop into it, right? You kind of go to a lab, you talk to your mentors, you talk to your colleagues, you learn, and then you study it, and then you try it in different snippets before you bring it on to a patient. That's what we're really good at, right? So if you can apply that same type of training and that process and that thoughtfulness to social media, then I think that one, it becomes fun. Two, you sort of feel like you're doing it safer. And three, it probably is more impactful early on because people have, sort of provided you with the support you need to sort of not just get started, but to keep it going. And the last thing I'll say to that is, um, if you find colleagues that you can do this with, it's so much fun, right? We think about why we participate in different professional aspects of the work that we do, and it's because we get to interact with a lot of our colleagues, right? Misery loves company, the joys that we face like love company. Just we want to do fun things with our friends and colleagues, and this is one of those adventures. But Kendra, I'd love to hear the student perspective too, because I have seen some wild things recently.
Yeah, no, absolutely. I think like finding a way to share your experiences in a very with a very realistic lens is probably the most important thing that I could give as like a takeaway from a medical student. And sometimes that's the case and sometimes that's not always the case. The University of Washington does like social media takeovers by some of their students where students get to share kind of day in the life type stories on either Instagram or X, where they just post series of clips about the things they do in a day. It's largely not patient care centered. It's more about the student's schedule. But that's one way that students can interact, at least in my opinion, in a way that's, fairly safe. Um, and allows them to kind of engage with social media platforms as well, if that's something that students are really passionate about. I also think that another thing I've seen done by students that was really cool is kind of sharing some of the research they've done in posts. Something gets published and they share what they published or maybe a short description of what it is, um, a, a blurb from the abstract or something like that, just to let people know that they're working on things in that avenue. I think any of those are wonderful things for students to pursue. I think kind of, Dr. Louis, as you alluded to, it's a fine line between being really excited about sharing your experiences, and putting something out there that could easily be misconstrued by people who don't maybe know exactly the process of medical school or what's going on. And so I think it's really important for students to be mindful of that when choosing what they want to share from their medical school experience online, because it takes up so much time and we dedicate so much of our lives, especially in this period, to the work we're doing. But we're not the only ones who are seeing that, and it's not only medical providers who are seeing that. And I think that's very, very important to just be aware of.
Both of you have highlighted some very important things about how to grow in the space, the importance of the space, and how to make content relevant. In your article, you have a line specifically stating that unfortunately, educational videos and videos created by musculoskeletal professionals had the lowest interaction compared to videos created by laypersons, casting doubt on the accuracy of spine related information. Over the last 20, 30 minutes, I've taken away at least 3, 4 tidbits to make better content. But as spine surgeons and orthopedic specialists and interventionalists, this is a bite to our egos. We have to be able to make better content. We have to be able to empower our patients better and engage them in more dialogue. And I think the tidbits from your article and this conversation hopefully can stimulate all of us creating more insightful and more engaging content. For closing remarks, anything else you'd like to share or add with our audience?
Also, I think one very fun thing with social media sort of participation that people overlook is that you get to meet a lot of friends and you just meet a lot of people along the way, right? We always joke as adults once you graduate college, it's hard to meet people. But I will say with social media, like I have gotten to meet so many of my colleagues that I would have otherwise never interacted with. And it doesn't mean that I agree with all of them. In fact, I disagree on several points and they disagree with me, but then I see them randomly at conferences or at industry events or, even send patients to each other despite our disagreements, because it's like a new way of developing the initial steps of relationships. And it's in a field where there needs to be more collaboration. That's been one of these like benefits and aspects that I've been really surprised and really enjoyed.
Yeah, and I think as intimidating as it can be to step into the social media space as a provider for a lot of the reasons we've talked about, I do think it's an important place for physicians and providers to step into, to share their knowledge, to share their expertise, to work on creating content that gets views so that we can dialogue with the public in a way that's more productive and maybe in some ways demystifies the idea of a spine surgeon or a musculoskeletal professional for them, because that can still be a pretty mysterious and ambiguous concept, I think, to a lot of people. And so I think while there are things to very much be mindful of and considerate of, it's still a space that we need to step into. And that was most evident to me through writing this paper.
One thing I did not see in the paper is what does it mean to be HIPAA compliant in social media?
That is a moving target, you know, and something that anyone who's posting any type of radiographs or notes, like we should be getting written permission from any patient in which we are presenting any of their health content, even if it's completely anonymous and everything has been scrubbed from an identifier standpoint. I think it's the right thing to do to get something written from your patients that they agree to having their own medical, information out there, because the last thing you would want as a patient is like, surfing online through a social media platform and realizing, hey, I think that's me.
I think that's my fluoro shot. Yeah, no.
Yeah.
Have you had a patient come in and say, "Hey, doc, I saw this surgery. Can you do this for me?" With a picture or something like that?
Oh, all the time. It's like people going to a barber with the haircut they want,
You pick the
That's just
number
part
one.
of the fun. Yeah, it's part of the fun, and it just opens the door to the next line of communication. So I don't mind that at all, because I know I would probably do the exact same thing.
I just think,
So,
I thought of my April Fool's joke, just have the barbershop line up with every type of disc replacement you can get.
well, there you go.
Guys, this has been a very engaging and fun conversation for me. Dr. Louis, I look forward to bumping into conferences with you and grabbing a drink in person. And student Dr. Kendra Cooper, good luck with your journey as well. Look forward for your contributions to the healthcare field and your ongoing research. Thank you guys so much for such an engaging conversation today.